certified nursing assistant activities of daily living.
Question 1. Which of the following is the nursing assistant most likely to observe in a resident who has low blood sugar? Option A, shakiness or trembling. Option B, thirst and dry mouth. Option C, sweet breath odor. Option D, increased urine output.
The correct answer is option A, shakiness or trembling. Shakiness, sweating, and confusion are common early signs of hypoglycemia, or low blood sugar.
Question 2. Residents are most likely to feel the urge to have a bowel movement at which time? Option A, after taking a nap. Option B, after eating a meal. Option C, just before bedtime. Option D, during the shift change.
The correct answer is option B, after eating a meal. Eating stimulates the gastrocolic reflex, which often results in the urge to defecate shortly after a meal.
Question 3. What is the best reason for giving frequent perineal care to residents? Option A, it increases comfort. Option B, it decreases sexual responses. Option C, it helps prevent skin breakdown. Option D, it prevents incontinence.
The correct answer is option C, it helps prevent skin breakdown. Removing urine and feces is essential because the moisture and acidity of waste can quickly damage the skin.
Question 4. A confused resident needs more help with dressing today than usual. What should the nursing assistant do? Option A, tell the resident not to feel bad about needing more help. Option B, provide extra help as needed to avoid frustration. Option C, ask if they would prefer to stay in night clothes for the day. Option D, check if the resident will get dressed for another assistant.
The correct answer is option B, provide extra help as needed to avoid frustration. Care should be adapted to the resident's current functional level to maintain their emotional well-being.
Question 5. While feeding a resident, you notice they are coughing a lot after each drink. What is the appropriate response? Option A, allow the resident more time to swallow. Option B, use a straw when giving the resident fluids. Option C, add a thickening product to the fluids. Option D, stop the feeding and ask a nurse to check the resident.
The correct answer is option D, stop the feeding and ask a nurse to check the resident. Persistent coughing is a primary sign of aspiration, which can lead to life-threatening pneumonia.
Question 6. A resident at the dining table begins to have a seizure. What should the assistant do next? Option A, guide the resident from the chair to the floor. Option B, remove the other residents away from the table. Option C, try to open the resident's mouth to check for food. Option D, keep the resident in the chair by holding their waist.
The correct answer is option A, guide the resident from the chair to the floor. Moving the resident to the floor prevents them from falling out of the chair and provides a safe space for the seizure to occur.
Question 7. A resident has pain in the arms and jaw and is sweating. What should you do? Option A, check the arms and jaw for possible injury. Option B, check the care plan to see if they are on heart precautions. Option C, ask if they ate something that upset their stomach. Option D, recognize the seriousness and report immediately.
The correct answer is option D, recognize the seriousness and report immediately. Pain in the jaw and arms, along with sweating, are classic signs of a heart attack.
Question 8. You notice a resident is eating very little of their lunch. What is the most important action? Option A, check if the resident was snacking before the meal. Option B, ask if the resident would like something else to eat. Option C, remind the resident that dinner is several hours away. Option D, check when the resident last had a bowel movement.
The correct answer is option B, ask if the resident would like something else to eat. Identifying and offering preferred alternatives ensures the resident maintains adequate nutritional intake.
Question 9. When cleaning, which area of the body is it most important to change the spot on the washcloth for each stroke? Option A, arms and hands. Option B, abdominal area. Option C, face and neck. Option D, perineal area.
The correct answer is option D, perineal area. Changing the washcloth area during perineal care prevents the spread of bacteria from one area to another.
Question 10. A resident with a feeding tube is scheduled for a shower. What is the appropriate response? Option A, disconnect the feeding tube temporarily to give the shower. Option B, protect the pump with a plastic bag. Option C, ask the charge nurse for assistance with the pump. Option D, give the resident a bed bath instead.
The correct answer is option C, ask the charge nurse for assistance with the pump. A nursing assistant is not authorized to manipulate feeding pumps, the nurse must manage the equipment.
Question 11. True or false, when shaving a resident, you should shave in the opposite direction of hair growth. Option A, true. Option B, false.
The correct answer is option B, false. Shaving in the direction of hair growth prevents skin irritation, nicks, and ingrown hairs.
Question 12. True or false, when a resident is in a wheelchair, the drainage bag should be placed on the floor? Option A, true. Option B, false.
The correct answer is option B, false. The bag should be attached to the chair frame and kept off the floor to prevent contamination.
Question 13. True or false, a nursing assistant may cut the toenails of a diabetic resident? Option A, true. Option B, false.
The correct answer is option B, false. Due to high infection risks, nail care for diabetic residents is usually performed by a nurse or podiatrist.
Question 14. True or false, a nursing assistant should report if a resident has not had a bowel movement for 3 days? Option A, true. Option B, false.
The correct answer is option A, true. Monitoring elimination patterns is critical for preventing complications like fecal impaction.
Question 15. True or false, when dressing a resident with a weak side, you should dress the weak side first? Option A, true. Option B, false.
The correct answer is option A, true. Dressing the weak side first makes it easier to position the garment over the limb with limited movement.
Question 16. True or false, perineal care should be performed from back to front? Option A, true. Option B, false.
The correct answer is option B, false. Always wash from front to back to avoid dragging bacteria from the rectum into the urinary tract.
Question 17. Which healthcare professional helps a resident return to their activities of daily living? Option A, physical therapist. Option B, social worker. Option C, occupational therapist. Option D, registered dietitian.
The correct answer is option C, occupational therapist. Occupational therapists help residents adapt to their environment and relearn tasks like dressing and eating.
Question 18. Which communication technique involves repeating the person's message in your own words? Option A, focusing. Option B, clarifying. Option C, paraphrasing. Option D, open-ended questioning.
The correct answer is option C, paraphrasing. Paraphrasing helps the assistant confirm they have correctly understood the resident's meaning.
Question 19. The inner layer of the skin which contains blood vessels and nerves is called what? Option A, the epidermis. Option B, the dermis. Option C, the skeletal layer. Option D, the epithelial layer.
The correct answer is option B, the dermis. The dermis is located beneath the epidermis and houses sweat glands and hair follicles.
Question 20. How often must a resident in physical restraints be released? Option A, once every hour. Option B, every 2 hours. Option C, once per shift. Option D, only when they need to use the bathroom.
The correct answer is option B, every 2 hours. Regular release is required to check skin integrity, provide range of motion, and offer toileting.
Question 21. What is the single most effective way to prevent the spread of infection? Option A, wearing a mask at all times. Option B, using double gloves. Option C, washing your hands. Option D, keeping all residents in their rooms.
The correct answer is option C, washing your hands. Hand hygiene is the foundation of infection control in all healthcare settings.
Question 22. When feeding a resident, how full should the spoon be? Option A, 1/3 full. Option B, half full. Option C, completely full. Option D, 2/3 full.
The correct answer is option A, 1/3 full. Small portions on the spoon prevent choking and allow the resident to chew effectively.
Question 23. What is a gastrostomy tube? Option A, a tube inserted through the nose. Option B, a feeding tube inserted through a surgical opening in the stomach. Option C, a tube used for intravenous fluids. Option D, a tube used to monitor heart rate.
The correct answer is option B, a feeding tube inserted through a surgical opening in the stomach. Gastrostomy tubes are used for long-term feeding through an opening in the abdominal wall.
Question 24. How often should a person's position be changed when they are sitting in a chair? Option A, every hour. Option B, every 2 hours. Option C, every 15 minutes. Option D, once a day.
The correct answer is option C, every 15 minutes. Frequent shifts are needed because sitting puts high pressure on small areas like the tailbone.
Question 25. What is fainting? Option A, a sudden loss of memory. Option B, a sudden loss of consciousness from a lack of blood supply to the brain. Option C, a type of physical exercise. Option D, a normal way to fall asleep.
The correct answer is option B, a sudden loss of consciousness from a lack of blood supply to the brain. Fainting is often preceded by dizziness, sweating, or blurred vision.
Question 26. What does the abbreviation BM stand for? Option A, a blood monitor. Option B, bowel movement. Option C, body Massachusetts. Option D, breathing method.
The correct answer is option B, bowel movement. A bowel movement is the excretion of feces from the body.
Question 27. How often should physical restraints be removed to provide care? Option A, once a day. Option B, every 2 hours. Option C, every 4 hours. Option D, only if the resident asks.
The correct answer is option B, every 2 hours. Removing restraints every 2 hours allows for movement, skin checks, and toileting.
Question 28. What does the abbreviation ADL stand for? Option A, advanced daily living. Option B, activities of daily living. Option C, assisted daily living. Option D, average daily limits.
The correct answer is option B, activities of daily living. Activities of daily living include basic self-care tasks like bathing, dressing, and eating.
Question 29. What does the abbreviation BM stand for? Option A, body mass. Option B, bowel movement. Option C, a blood monitor. Option D, breathing method.
The correct answer is option B, bowel movement. A bowel movement is the excretion of solid waste from the digestive tract.
Question 30. What does the abbreviation DRSG stand for? Option A, dressing. Option B, dosage. Option C, drainage. Option D, driving.
The correct answer is option A, dressing. A dressing is a protective covering applied to a wound.
Question 31. What does the abbreviation OOB stand for? Option A, only on bed. Option B, out of bed. Option C, observation of body. Option D, only one body.
The correct answer is option B, out of bed. Out of bed indicates the resident is allowed to be upright or in a chair.
Question 32. What does the abbreviation WC stand for? Option A, with care. Option B, wheelchair. Option C, warm compress. Option D, water closet.
The correct answer is option B, wheelchair. A wheelchair is a chair with wheels used by people who cannot walk.
Question 33. Which of the following would you observe in a resident with low blood sugar? Option A, sweet breath odor. Option B, shakiness or trembling. Option C, dry mouth. Option D, increased urine.
The correct answer is option B, shakiness or trembling. Hypoglycemia often causes physical symptoms like tremors, sweating, and weakness.
Question 34. When are residents most likely to feel the urge to have a bowel movement? Option A, before breakfast. Option B, after eating a meal. Option C, just before bed. Option D, during the night.
The correct answer is option B, after eating a meal. The gastrocolic reflex is most active following the intake of food.
Question 35. If a resident's breathing gets faster and they feel tired while dressing, what is the first action? Option A, dress them faster to finish. Option B, tell them to keep going. Option C, stop the dressing to let them rest. Option D, call for an ambulance.
The correct answer is option C, stop the dressing to let them rest. The priority is to reduce physical exertion and allow the resident to recover.
Question 36. What is the best reason for giving frequent perineal care? Option A, to decrease sexual responses. Option B, it increases the assistant's work. Option C, it helps prevent skin breakdown. Option D, it prevents incontinence.
The correct answer is option C, it helps prevent skin breakdown. Keeping the area clean and dry prevents irritation and damage from urine and feces.
Question 37. Pain in the arms and jaw, along with nausea and sweating, can indicate what? Option A, indigestion. Option B, a heart attack. Option C, the flu. Option D, a skin allergy.
The correct answer is option B, a heart attack. These are classic signs of cardiac distress that require immediate emergency reporting.
Question 38. What should you do if a resident is eating very little lunch? Option A, check if they were snacking earlier. Option B, ask if they would like something else to eat. Option C, tell them dinner is a long way off. Option D, check their last bowel movement.
The correct answer is option B, ask if they would like something else to eat. Providing a preferred alternative helps maintain the resident's nutritional status.
Question 39. During perineal care, why is it important to change the spot on the washcloth? Option A, to save on laundry. Option B, to keep the soap from drying out. Option C, to prevent the spread of bacteria. Option D, to make the procedure faster.
The correct answer is option C, to prevent the spread of bacteria. Using a clean area of the cloth for each stroke ensures you are not moving germs back and forth.
Question 40. A resident with a feeding tube pump needs a shower. What is the correct response? Option A, disconnect the tube yourself. Option B, protect the pump with a bag and take it in. Option C, ask the charge nurse for assistance with the pump. Option D, give a bed bath instead.
The correct answer is option C. Ask the charge nurse for assistance with the pump. Nursing assistants are not authorized to handle or disconnect medical pumps.
Question 41. When transferring a resident from a wheelchair to a stationary chair, where should the nursing assistant stand? Option A, to the left of the side of the wheelchair. Option B, to the right side of the wheelchair. Option C, in front of the wheelchair. Option D, behind the wheelchair.
The correct answer is option C, in front of the wheelchair. Standing in front of the resident allows the assistant to provide support and stability during the pivot.
Question 42. Which of these is least likely to contribute to skin tears? Option A, medical equipment. Option B, resident falls. Option C, length of hair. Option D, length of nails.
The correct answer is option C, length of hair. Long hair does not typically cause skin tears, whereas long nails or falls are common causes.
Question 43. Talking to residents about spiritual beliefs can have an effect on which of the following? Option A, the resident's feeling of connectedness. Option B, the resident's mental health. Option C, physical and mental health and feelings of connectedness. Option D, the resident's physical health only.
The correct answer is option C, physical and mental health and feelings of connectedness. Addressing spiritual needs supports the resident's overall well-being and emotional health.
Question 44. When a resident refuses a bath, what is your responsibility? Option A, respect the resident's wishes. Option B, tell the resident they cannot have visitors. Option C, call the family to persuade them. Option D, give the resident a bath anyway but make it shorter.
The correct answer is option A, respect the resident's wishes. Residents have the right to refuse any part of their care, including hygiene.
Question 45. Which bathing consideration is frequently forgotten by caregivers? Option A, the use of proper body mechanics. Option B, ensuring the water is at a safe temperature. Option C, rinsing and drying the resident thoroughly. Option D, beliefs about bathing frequency differs among cultures.
The correct answer is option D, beliefs about bathing frequency differs among cultures. Cultural preferences regarding hygiene should be respected in the care plan.
Question 46. What is an important, but frequently forgotten, consideration when providing hair care? Option A, the age of the resident. Option B, the length of the resident's stay. Option C, the race and culture of the resident. Option D, the environmental conditions of the room.
The correct answer is option C, the race and culture of the resident. Hair textures and cultural styles require specific knowledge and appropriate products.
Question 47. A resident is late to therapy because she is slow at feeding herself. What is the best action? Option A, bring the resident to breakfast earlier. Option B, withhold breakfast until after therapy. Option C, begin feeding the resident yourself. Option D, take her plate away when it is time for therapy.
The correct answer is option A, bring the resident to breakfast earlier. Adjusting the schedule allows the resident to remain independent while meeting their appointments.
Question 48. Which of these may depend on facility rules when performing nail care? Option A, reporting blue or pale nail beds to the nurse. Option B, the policy on cutting toenails. Option C, the position of the resident during care. Option D, soaking the feet before starting.
The correct answer is option B, the policy on cutting toenails. Many facilities restrict nursing assistants from cutting toenails, especially for diabetic residents.
Question 49. Which of these is an incorrect procedure for shaving a resident? Option A, using a towel to protect clothing. Option B, checking for bleeding problems first. Option C, shaving upward from the chin to the sideburns. Option D, shaving upward on the neck.
The correct answer is option C, shaving upward from the chin to the sideburns. To prevent irritation, shaving should follow the direction of hair growth, which is typically downward on the face.
Question 50. A resident with left side weakness needs help with a sweater. Assistance should be given where? Option A, on the resident's right side. Option B, in front of the resident. Option C, on the resident's left side. Option D, behind the resident.
The correct answer is option C, on the resident's left side. When dressing a resident with weakness, you should always dress the weak side first.
Question 51. A nursing assistant is feeding a quadriplegic resident. Which action is inappropriate? Option A, offering small bites and allowing time to chew. Option B, encouraging personable conversation. Option C, sitting at eye level with the resident. Option D, offering drinks only after all food is consumed.
The correct answer is option D, offering drinks only after all food is consumed. Fluids should be offered throughout the meal to assist with swallowing and hydration.
Question 52. Why is morning care before breakfast important? Option A, it adds to a resident's sense of well-being. Option B, it helps to promote eating. Option C, it provides a pleasant appearance. Option D, all of these are correct.
The correct answer is option D. All of these are correct. Hygiene before meals improves comfort and is a standard part of resident care.
Question 53. Key considerations for bathing residents include safety, privacy, and which of these? Option A, quiet surroundings. Option B, dim lighting. Option C, swiftness in the procedure. Option D, providing security.
The correct answer is option D, providing security. Ensuring the resident feels physically and emotionally secure is vital during bathing.
Question 54. It is time to bathe an Alzheimer's resident who has visitors. What is the best action? Option A, ask the charge nurse to speak with the visitors. Option B, ask the visitors to step out until the bath is complete. Option C, perform the bath the next day instead. Option D, ask the patient when you should come back.
The correct answer is option B, ask the visitors to step out until the bath is complete. Bathing is a private activity and visitors should be asked to leave to maintain dignity.
Question 55. What should you put on a client's feet before walking them to a chair? Option A, socks or stockings only. Option B, cloth-soled slippers. Option C, rubber-soled slippers or shoes. Option D, nothing.
The correct answer is option C, rubber-soled slippers or shoes. Non-skid footwear is essential to prevent falls during ambulation.
Question 56. What is the most important reason for using soap and water to clean skin after elimination? Option A, to keep the client happy. Option B, to prevent soiling of bed linen. Option C, to remove feces and urine from the skin. Option D, to keep the linen costs down.
The correct answer is option C, to remove feces and urine from the skin. Waste products are caustic and will cause rapid skin breakdown if not removed.
Question 57. A client is incontinent of urine right before dinner. What should you do? Option A, take the client to dinner and clean up later. Option B, clean the client and take them to dinner as soon as possible. Option C, tell them not to eat until they have changed themselves. Option D, insist the client eat dinner in their room.
The correct answer is option B, clean the client and take them to dinner as soon as possible. Maintaining hygiene and dignity is a priority. Clean the resident before they go to a public area.
Question 58. A radio cord is draped across a chair to reach an outlet. What is the first thing to do? Option A, tell the client it is a hazard and take it away. Option B, unplug the radio and ask them not to use it. Option C, see if changes can be made so the radio can be plugged in safely. Option D, take the radio to the activities room.
The correct answer is option C, see if changes can be made so the radio can be plugged in safely. Problem solving to maintain safety while respecting resident property is the best approach.
Question 59. A fire alarm sounds while you are walking with a client in a wheelchair. What should you do? Option A, push the chair out of the hall and carry the client. Option B, leave the client to search for help. Option C, comfort the client while moving to a safe place. Option D, lock the wheelchair and check for smoke.
The correct answer is option C, comfort the client while moving to a safe place. Reassuring the resident while moving them away from danger is the correct response.
Question 60. When caring for a client from another country, the nursing assistant should do what? Option A, be sensitive to the client's cultural needs. Option B, force them to follow facility cultural practices. Option C, promote group activity participation only. Option D, decline to care for the client.
The correct answer is option A, be sensitive to the client's cultural needs. Culturally sensitive care is a requirement for treating the resident with dignity.
Question 61. How often should a nursing assistant give an unconscious client oral hygiene? Option A, at least every 2 hours. Option B, at least every 4 hours. Option C, at least every 6 hours. Option D, at least every 8 hours.
The correct answer is option A, at least every 2 hours. Frequent care is necessary to prevent infection and dry membranes in an unconscious patient.
Question 62. Which action makes the procedure of moving a resident to a wheelchair safe? Option A, place the bed in the low position. Option B, place a pillow on the wheelchair seat. Option C, lower both footrest pedals. Option D, release the wheel brakes.
The correct answer is option A. Place the bed in the low position. Keeping the bed low allows the resident's feet to reach the floor for stability.
Question 63. Which of the following is considered a restraint alternative? Option A, a lap buddy or tray. Option B, a sedative. Option C, effective pain management. Option D, a hand mitt.
The correct answer is option C. Effective pain management. Treating the underlying cause of agitation can remove the need for physical restraints.
Question 64. In what position should you place an unconscious person for oral care? Option A, supine. Option B, lateral. Option C, prone. Option D, Sims position.
The correct answer is option B. Lateral. A side-lying position prevents the resident from choking on fluids during care.
Question 65. What is the best razor to use when shaving a diabetic client? Option A, a safety razor. Option B, an electric razor. Option C, a disposable razor. Option D, a straight edge razor.
The correct answer is option B. An electric razor. Electric razors reduce the risk of nicks and cuts, which are dangerous for diabetics.
Question 66. You notice new swelling in a resident's ankles while bathing. What is the best response? Option A, ask if they have been eating salty foods. Option B, elevate the legs and check again later. Option C, report the swelling to the charge nurse. Option D, avoid bathing the lower legs.
The correct answer is option C. Report the swelling to the charge nurse. New edema can indicate heart or kidney issues and requires a professional assessment.
Question 67. A resident has a contracture of the right arm. How do you put on a button front shirt? Option A, put the left sleeve on first. Option B, ask which arm they prefer. Option C, put the right sleeve on first. Option D, put both on at the same time.
The correct answer is option C. Put the right sleeve on first. When dressing a resident with a limitation, always dress the affected side first.
Question 68. What is the medical term for sweating? Option A, dehydration. Option B, diaphoresis. Option C, cyanosis. Option D, jaundice.
The correct answer is option B. Diaphoresis. Heavy sweating can be a sign of pain, fever, or a heart attack.
Question 69. Which term refers to threatening to harm someone without their consent? Option A, assault. Option B, battery. Option C, libel. Option D, slander.
The correct answer is option A. Assault. Assault is the act of creating an apprehension of harmful or offensive contact.
Question 70. Besides regulating temperature, what is a primary function of sweat glands? Option A, producing oil for the hair. Option B, eliminating solid waste. Option C, helping the body cool down through evaporation. Option D, producing red blood cells.
The correct answer is option C. Helping the body cool down through evaporation. Sweating is a critical mechanism for maintaining homeostasis in body temperature.
Question 71. What is the medical term for emptying urine from the bladder? Option A, defecation. Option B, voiding. Option C, emesis. Option D, exhalation.
The correct answer is option B. Voiding. Voiding and urinating are the terms used for bladder elimination.
Question 72. What is an ostomy? Option A, a surgically created opening into the body. Option B, a type of blood test. Option C, a medication for pain. Option D, a physical therapy exercise.
The correct answer is option A, a surgically created opening into the body. Ostomies are used for elimination when the normal path is blocked or damaged.
Question 73. How full should a spoon be when feeding a dependent resident? Option A, 1/3 full. Option B, half full. Option C, completely full. Option D, it does not matter.
The correct answer is option A, 1/3 full. Small amounts on the spoon help prevent choking and allow for easier swallowing.
Question 74. In skin care, what is friction? Option A, layers of skin rubbing against each other. Option B, the rubbing of one thing against another like skin against a sheet. Option C, a type of bacterial infection. Option D, the process of a wound closing.
The correct answer is option B, the rubbing of one thing against another like skin against a sheet. Friction can cause skin tears and contribute to the formation of pressure ulcers.
Question 75. How often should a resident's position be changed when they are sitting in a chair? Option A, every hour. Option B, every 2 hours. Option C, every 15 minutes. Option D, once a day.
The correct answer is option C, every 15 minutes. Frequent movement is necessary to prevent pressure on the tailbone while sitting.
Question 76. What is the final step of every clinical procedure to ensure infection control? Option A, reporting to the nurse. Option B, cleaning the equipment. Option C, washing your hands. Option D, opening the curtains.
The correct answer is option C, washing your hands. Hand hygiene after care prevents the spread of pathogens throughout the facility.
Question 77. What is the first step in treating a conscious choking resident? Option A, perform chest compressions. Option B, ask the resident if they are choking. Option C, give them a glass of water. Option D, lay them on their side.
The correct answer is option B, ask the resident if they are choking. Confirming the resident cannot breathe or speak identifies a total airway obstruction.
Question 78. What is the correct angle for a resident in Fowler's position? Option A, 10 to 20 degrees. Option B, 30 to 45 degrees. Option C, 60 to 90 degrees. Option D, flat on the back.
The correct answer is option C, 60 to 90 degrees. High Fowler's position is an upright sitting position used for eating and breathing support.
Question 79. When transferring a resident from bed to wheelchair, where should the wheelchair be positioned? Option A, at the foot of the bed. Option B, on the resident's strong side. Option C, behind the resident. Option D, 2 feet away from the bed.
The correct answer is option B, on the resident's strong side. Positioning on the strong side allows the resident to help pull themselves into the chair.
Question 80. What is the first action when feeding a dependent resident? Option A, give them a large drink of water. Option B, check that the name and diet on the tray match the resident. Option C, start with the dessert. Option D, mix all the food together.
The correct answer is option B, check that the name and diet on the tray match the resident. Verifying the identity and diet prevents medical errors and allergic reactions.
Question 81. At what angle should a resident be positioned for safe feeding? Option A, flat on their back. Option B, minimum of 30 degrees. Option C, minimum of 60 degrees. Option D, standing up.
The correct answer is option C, minimum of 60 degrees. An upright position is vital for preventing aspiration and choking during meals.
Question 82. When dressing a resident with hemiplegia, which side of the garment should be put on first? Option A, the strong side. Option B, the side the resident chooses. Option C, the weak side. Option D, both sides at once.
The correct answer is option C, the weak side. Dressing the weak side first allows for easier manipulation of the garment over the limb with limited movement.
Question 83. When shaving a resident's face with a razor blade, how should the skin be held? Option A, loose and folded. Option B, gently pulled taut. Option C, pushed downward. Option D, it should not be touched.
The correct answer is option B, gently pulled taut. Taut skin provides a flat surface for the razor and reduces the risk of nicks and cuts.
Question 84. In which direction should a nursing assistant shave a resident's face? Option A, against the direction of hair growth. Option B, in the direction the hair is growing. Option C, in a circular motion. Option D, from side to side.
The correct answer is option B, in the direction the hair is growing. Shaving with the grain prevents skin irritation and ingrown hairs.
Question 85. When providing perineal care for a female, what is the correct cleaning direction? Option A, from back to front. Option B, from the thighs to the labia. Option C, from front to back. Option D, in a circular motion.
The correct answer is option C, from front to back. Washing from front to back prevents the spread of fecal bacteria into the vagina or urethra.
Question 86. When cleaning the anal area during peri-care, in which direction should you wipe? Option A, from front to back. Option B, from the rectum toward the vagina. Option C, from side to side. Option D, only in circles.
The correct answer is option A, from front to back. Cleaning away from the cleaner areas toward the rectum maintains hygiene and prevents infection.
Question 87. What does the abbreviation WC stand for? Option A, with care. Option B, wheelchair. Option C, water closet. Option D, warm compress.
The correct answer is option B, wheelchair. A wheelchair is a standard assistive device for non-ambulatory residents.
Question 88. Who helps a resident return to their activities of daily living like dressing? Option A, physical therapist. Option B, occupational therapist. Option C, social worker. Option D, dietitian.
The correct answer is option B, occupational therapist. Occupational therapists specialize in fine motor skills and daily tasks.
Question 89. What is the most effective way to prevent the spread of infection? Option A, wearing 2 pairs of gloves. Option B, washing your hands. Option C, keeping the windows closed. Option D, talking less to residents.
The correct answer is option B, washing your hands. Hand hygiene is the single most important defense against germs.
Question 90. How often must a physical restraint be completely released to provide care? Option A, once per shift. Option B, every 2 hours. Option C, once every 4 hours. Option D, only if the resident asks for it.
The correct answer is option B, every 2 hours. Restraints must be removed every 2 hours to check skin, provide movement, and offer toileting.
Question 91. What is the most effective way to prevent the spread of healthcare-associated infections? Option A, wearing a face shield at all times. Option B, keeping the resident's door closed. Option C, proper and frequent hand washing. Option D, using double gloves for all tasks.
The correct answer is option C, proper and frequent hand washing. Hand hygiene is the single most important intervention in breaking the chain of infection.
Question 92. When feeding a dependent resident, how full should the spoon be? Option A, 1/3 full. Option B, half full. Option C, completely full. Option D, it does not matter.
The correct answer is option A, 1/3 full. Small amounts on the spoon allow the resident to chew and swallow more easily and safely.
Question 93. How often should a resident's position be changed when they are sitting in a chair? Option A, every hour. Option B, every 2 hours. Option C, every 15 minutes. Option D, once a day.
The correct answer is option C, every 15 minutes. Frequent microadjustments are needed because sitting puts high pressure on the tailbone.
Question 94. What does the abbreviation ADL mean? Option A, activities of daily living. Option B, advanced dietary limits. Option C, average daily loss. Option D, ambulatory daily lesson.
The correct answer is option A, activities of daily living. ADLS include basic tasks like bathing, dressing, and using the toilet.
Question 95. Which device is used to assist a dependent resident from a bed to a chair? Option A, a life jacket. Option B, a transfer or gait belt. Option C, a pair of handcuffs. Option D, a rope.
The correct answer is option B, a transfer or gait belt. Gait belts provide a secure grip for the assistant to guide the resident safely.
Question 96. True or false, a nursing assistant may cut a diabetic resident's toenails? Option A, true. Option B, false.
The correct answer is option B, false. Toenail care for diabetics is usually restricted to nurses or podiatrists.
Question 97. True or false, you should report if a resident hasn't had a bowel movement in 3 days? Option A, true. Option B, false.
The correct answer is option A, true. Reporting irregular elimination prevents serious complications like impaction.
Question 98. True or false, you should dress the weak side first? Option A, true. Option B, false.
The correct answer is option A, true. Dressing the weak side first allows for easier manipulation of the garment.
Question 99. While eating dinner, a client starts to choke and turn blue. What should the nurse aide do? Option A, remove the food tray and find the nurse. Option B, slap the client on the back. Option C, call for assistance and perform the Heimlich maneuver. Option D, give the client a drink of water.
The correct answer is option C, call for assistance and perform the Heimlich maneuver. Abdominal thrusts are the emergency intervention for a complete airway obstruction.
Question 100. What should a nurse aide put on a client's feet before helping them walk to a chair? Option A, socks or stockings only. Option B, cloth-soled slippers. Option C, rubber-soled slippers or shoes. Option D, nothing.
The correct answer is option C, rubber-soled slippers or shoes. Non-skid footwear is essential to provide traction and prevent falls during ambulation.
Question 101. What is the most important reason for using soap and water to clean a client's skin after elimination? Option A, to keep the client happy. Option B, to prevent soiling of bed linen. Option C, to remove feces and urine from the skin. Option D, to keep the linen costs down.
The correct answer is option C, to remove feces and urine from the skin. Urine and feces are caustic to the skin and must be thoroughly removed to prevent breakdown.
Question 102. A client is incontinent of urine right before dinner. What should the nurse aide do? Option A, take the client to the dinner table and clean up later. Option B, clean the client and take them to dinner as soon as possible. Option C, tell the client not to eat until they have changed themselves. Option D, insist that the client eat dinner in their room.
The correct answer is option B. Clean the client and take them to dinner as soon as possible. Maintaining the resident's dignity and hygiene is a priority before taking them to a public area.
Question 103. A radio cord is draped across a chair to reach an outlet. What is the first thing the nurse aide should do? Option A, tell the client the radio is a hazard and take it away. Option B, unplug the radio and ask the client not to use it. Option C, see if changes can be made so the radio can be plugged in safely. Option D, take the radio to the activities room.
The correct answer is option C. See if changes can be made so the radio can be plugged in safely. The goal is to maintain safety while respecting the resident's rights and personal property.
Question 104. A fire alarm is activated while a nurse aide is walking with a resident in a wheelchair. What should the aide do? Option A, push the wheelchair out of the hallway and carry the client. Option B, leave the client to search for help. Option C, comfort the client while moving to a safe place. Option D, lock the wheelchair and check the area for smoke.
The correct answer is option C. Comfort the client while moving to a safe place. Keeping the resident calm and moving them away from danger is the correct emergency response.
Question 105. How often should a nurse aide give an unconscious client oral hygiene? Option A, at least every 2 hours. Option B, at least every 4 hours. Option C, at least every 6 hours. Option D, at least every 8 hours.
The correct answer is option A, at least every 2 hours. Unconscious residents need frequent mouth care to keep tissues moist and prevent infection.
Question 106. Which action makes the procedure of moving a resident to a wheelchair safe? Option A, place the bed in the low position. Option B, place a pillow on the wheelchair seat. Option C, lower both footrest pedals before the transfer. Option D, release the wheel brakes.
The correct answer is option A, place the bed in the low position. Lowering the bed allows the resident's feet to reach the floor, which is critical for a safe transfer.
Question 107. Which of the following is considered a restraint alternative? Option A, a lap buddy or tray. Option B, a sedative. Option C, effective pain management. Option D, a hand mitt.
The correct answer is option C, effective pain management. Addressing the underlying cause of agitation, such as pain, can eliminate the need for physical restraints.
Question 108. In what position should a nurse aide place an unconscious person for oral care? Option A, supine. Option B, lateral. Option C, prone. Option D, Sims position.
The correct answer is option B, lateral. A side-lying or lateral position allows fluids to drain from the mouth and prevents aspiration.
Question 109. What is the best razor to use when shaving a diabetic client? Option A, a safety razor. Option B, an electric razor. Option C, a disposable razor. Option D, a straight edge razor.
The correct answer is option B, an electric razor. Electric razors have the lowest risk of causing nicks or cuts, which is vital for diabetic safety.
Question 110. A resident has a contracture of the right arm. How should the aide put on a button front shirt? Option A, put the shirt sleeve on the left arm first. Option B, ask which arm the resident prefers. Option C, put the shirt sleeve on the right arm first. Option D, put both sleeves on at the same time.
The correct answer is option C, put the shirt sleeve on the right arm first. When dressing a resident with a physical limitation, always dress the affected or weak side first.
Question 111. When giving perineal care to an uncircumcised male, what should the aide do? Option A, push the foreskin back to clean. Option B, keep the foreskin in place over the penis. Option C, wipe from the base of the penis towards the tip. Option D, cleanse only the tip and the urethra.
The correct answer is option A, push the foreskin back to clean. The foreskin must be gently retracted to clean the area where bacteria and secretions accumulate.
Question 112. A resident on a toileting schedule asks to go to the bathroom frequently. What should the aide do? Option A, tell the resident that it is not time. Option B, decrease the resident's fluid intake. Option C, ask the resident to follow the schedule. Option D, take the resident to the bathroom as needed.
The correct answer is option D, take the resident to the bathroom as needed. Immediate needs for elimination take priority over schedules to maintain dignity and skin health.
Question 113. Where should a urinary drainage bag be placed when a resident is in a wheelchair? Option A, on the floor directly next to the wheelchair. Option B, tucked at the resident's side on the seat. Option C, hung from the back of the chair above the bladder. Option D, attached to the chair frame below the level of the bladder.
The correct answer is option D, attached to the chair frame below the level of the bladder. Drainage bags must always stay below the level of the bladder to facilitate gravity flow and prevent infection.
Question 114. To soften the beard before shaving with a disposable razor, what should the aid do? Option A, massage the beard area gently. Option B, rub the beard in the direction of hair growth. Option C, hold a warm, wet washcloth against the face first. Option D, lather the face with soap instead of shaving cream.
The correct answer is option C, hold a warm, wet washcloth against the face first. Warm moisture softens hair and skin, resulting in a closer shave with less irritation.
Question 115. How can the nurse aide help the resident have regular bowel movements? Option A, making sure the resident gets a lot of rest. Option B, providing a routine time for the resident to toilet. Option C, giving the resident cereal for breakfast every morning. Option D, keeping a bedpan within reach in bed.
The correct answer is option B, providing a routine time for the resident to toilet. Establishing a predictable routine helps regulate the body's natural elimination patterns.
Question 116. When giving perineal care to a male resident who is uncircumcised, the nursing assistant should take which action? Option A, push the foreskin back to clean. Option B, keep the foreskin in place over the penis. Option C, wipe from the base of the penis towards the tip. Option D, just cleanse the tip and directly over the urethra.
The correct answer is option A, push the foreskin back to clean. For uncircumcised males, the foreskin must be gently retracted to clean the area underneath where bacteria can collect.
Question 117. A resident who is on a toileting schedule asks to go to the bathroom frequently. The nursing assistant should respond by doing what? Option A, telling the resident that it is not time. Option B, decreasing the resident's fluid intake. Option C, asking the resident to follow the schedule. Option D, taking the resident to the bathroom as needed.
The correct answer is option D, taking the resident to the bathroom as needed. Residents' immediate needs take priority over a set schedule to maintain dignity and prevent incontinence.
Question 118. Where should the nursing assistant place a urinary drainage bag when the resident is in a wheelchair? Option A, on the floor directly next to the wheelchair. Option B, tucked at the resident's side on the seat of the chair. Option C, hung from the back of the wheelchair above the bladder. Option D, attached to the wheelchair frame below the level of the bladder.
The correct answer is option D, attached to the wheelchair frame below the level of the bladder. Gravity is needed for urine to flow from the bladder. The bag must always stay below the level of the bladder to prevent backflow.
Question 119. To help soften the beard before shaving with a disposable razor, the nursing assistant should do what? Option A, massage the beard area of the face gently. Option B, rub the beard in the direction of the hair growth. Option C, hold a warm, wet washcloth against the face first. Option D, lather the face with soap instead of shaving cream.
The correct answer is option C, hold a warm, wet washcloth against the face first. Warmth and moisture soften the hair and skin, reducing the risk of nicks and irritation during shaving.
Question 120. While bathing a comatose resident, you notice a reddened area on the hip. What is the most likely instruction from the nurse? Option A, massage the area using lotion. Option B, apply a dry protective dressing over the area. Option C, keep the resident positioned to avoid pressure on the hip. Option D, cleanse the hip using extra soap and rinse thoroughly.
The correct answer is option C, keep the resident positioned to avoid pressure on the hip. The most important intervention for a suspected pressure injury is to remove all pressure from the affected site.
Question 121. The nursing assistant can help the resident have regular bowel movements by doing what? Option A, making sure the resident gets a lot of rest. Option B, providing a routine time for the resident to toilet. Option C, giving the resident cereal for breakfast every morning. Option D, keeping a bedpan within reach while they are in bed.
The correct answer is option B, providing a routine time for the resident to toilet. Establishing a predictable routine helps the body's digestive system regulate eliminations.
Question 122. How many times should each exercise be repeated during passive range of motion? Option A, 1 time. Option B, at least 3 times. Option C, at least 10 times. Option D, until the resident says to stop.
The correct answer is option B, at least 3 times. Repeating the motion at least 3 times helps maintain joint flexibility.
Question 123. When transferring a resident from a bed to a wheelchair, where should the wheelchair be positioned? Option A, at the foot of the bed. Option B, on the resident's weak side. Option C, on the resident's strong side. Option D, 2 feet away from the bed.
The correct answer is option C, on the resident's strong side. Transferring toward the strong side allows the resident to use their functional limbs for support.
Question 124. When feeding a dependent resident, at what angle should the resident be positioned? Option A, flat on their back. Option B, minimum of 30 degrees. Option C, minimum of 60 degrees. Option D, standing up.
The correct answer is option C, minimum of 60 degrees. An upright position is necessary to prevent choking and aspiration during feeding.
Question 125. How often should oral care be performed for an unconscious resident? Option A, once per shift. Option B, every 2 hours. Option C, every 8 hours. Option D, once a day.
The correct answer is option B, every 2 hours. Unconscious residents cannot swallow saliva or take in fluids, leading to rapid mouth dryness and bacterial growth.
Question 126. When providing foot care, how long should the feet be soaked in warm water? Option A, 1 minute. Option B, 5 to 10 minutes. Option C, 30 minutes. Option D, 1 hour.
The correct answer is option B, 5 to 10 minutes. Soaking for a short period softens the skin and nails without causing excessive pruning or damage.
Question 127. When dressing a resident with hemiplegia, which side should be dressed first? Option A, the strong side. Option B, the weak side. Option C, it does not matter. Option D, the side the resident chooses.
The correct answer is option B, the weak side. Dressing the weak side first allows for easier manipulation of the garment over the restricted limb.
Question 128. When shaving a resident with a razor blade, in which direction should you shave? Option A, against the direction of hair growth. Option B, in the direction the hair is growing. Option C, in a circular motion. Option D, from side to side.
The correct answer is option B, in the direction the hair is growing. Shaving in the direction of hair growth reduces skin irritation and the risk of ingrown hairs.
Question 129. When providing perineal care for a female, in which direction should you wash? Option A, from back to front. Option B, from front to back. Option C, in a circular motion around the vagina. Option D, from the thighs toward the labia.
The correct answer is option B, from front to back. Washing from front to back prevents fecal matter from entering the vagina or urinary tract.
Question 130. When cleaning the anal area during perineal care, you should wash in which direction? Option A, from the rectum toward the vagina. Option B, from the front toward the back. Option C, from side to side. Option D, only in circular motions.
The correct answer is option B, from the front toward the back. Cleaning from front to back ensures that bacteria is moved away from the cleaner areas of the body.
Question 131. Mrs. Jones is on a bowel training program but has not had a bowel movement for 3 days. What should you do? Option A, report it to the charge nurse. Option B, give the patient an enema. Option C, offer her prune juice immediately. Option D, increase her fluids yourself.
The correct answer is option A, report it to the charge nurse. The nursing assistant must report the status to the nurse, who will then decide on the appropriate medical intervention.
Question 132. When assisting a client with eating, one of the first things the nursing assistant should do is what? Option A, cut the food into bite-sized pieces. Option B, wash your hands and the client's hands. Option C, butter the client's bread. Option D, provide the client with privacy.
The correct answer is option B, wash your hands and the client's hands. Cleanliness before meals is essential for infection control and resident comfort.
Question 133. Encouraging a client to take part in activities of daily living like bathing and combing hair is what? Option A, done only when time permits. Option B, the responsibility of the family. Option C, necessary for rehabilitation. Option D, a violation of client rights.
The correct answer is option C, necessary for rehabilitation. Promoting independence helps the resident maintain their current level of function and self-esteem.
Question 134. Before assisting a client into a wheelchair, the first action should be to check what? Option A, if the client is adequately covered. Option B, if the floor is slippery. Option C, if the door to the room is closed. Option D, if the wheels of the chair are locked.
The correct answer is option D, if the wheels of the chair are locked. Locking the wheels prevents the chair from rolling away while the resident is trying to sit down.
Question 135. You are transferring a resident with a weak left side from the bed to a wheelchair. Where should you stand? Option A, on the right side. Option B, in front of the patient. Option C, on the left side. Option D, behind the patient.
The correct answer is option C, on the left side. Standing on the weak side allows you to provide the most support if the resident's leg gives way.
Question 136. When moving a wheelchair onto an elevator, you should stay in what position? Option A, behind the chair, pulling it toward you. Option B, behind the chair, pushing it away from you. Option C, in front of the client to observe them. Option D, to the side and hold the door open.
The correct answer is option A, behind the chair, pulling it toward you. Backing into an elevator with a wheelchair is safer as it prevents the small front wheels from getting stuck.
Question 137. Mrs. Wilkes is scheduled for a partial bed bath. This means you must wash her what? Option A, face, neck, ears, arms, and hands. Option B, face, underarms, hands, and buttocks. Option C, face, hands, underarms, and legs. Option D, face, hands, underarms, buttocks, and genitals.
The correct answer is option D, face, hands, underarms, buttocks, and genitals. A partial bath focuses on the areas that require the most frequent cleaning for hygiene and odor control.
Question 138. A client's religion forbids eating pork and bacon is being served. The most appropriate response is to do what? Option A, encourage the client to eat it for the protein. Option B, tell the client it is alright because the doctor ordered it. Option C, call the kitchen for a tray without bacon. Option D, tell the client that restrictions are not as important as health.
The correct answer is option C, call the kitchen for a tray without bacon. Healthcare workers must facilitate a resident's religious practices whenever possible.
Question 139. When a weak resident is positioned in a chair, where should the signaling device be? Option A, on the nurse's station. Option B, on the resident's bed. Option C, within the client's reach. Option D, in the resident's pocket.
The correct answer is option C, within the client's reach. Safety requires that the resident can call for help regardless of where they are sitting.
Question 140. How can a nursing assistant promote independence when bathing a client who had a stroke? Option A, do everything for the client to save time. Option B, encourage the client to do as much as possible and assist as needed. Option C, tell the client they are too slow and take over. Option D, make the client do everything without any help.
The correct answer is option B, encourage the client to do as much as possible and assist as needed. Encouraging self-care helps the resident regain function and maintain self-esteem.
Question 141. When changing a soiled dressing, when should the nursing assistant wash their hands? Option A, only at the end of the procedure. Option B, before, during, and after the procedure. Option C, only before starting. Option D, hand washing is not necessary if you wear gloves.
The correct answer is option B, before, during, and after the procedure. Multiple hand washes prevent the cross-contamination of clean supplies and the environment.
Question 142. When assisting a client with right-sided weakness to transfer from a wheelchair, you should support which side? Option A, the left side. Option B, the right side. Option C, both sides equally. Option D, no support is needed.
The correct answer is option B, the right side. The weak side is the most likely to buckle or fail, so it requires the most support from the assistant.
Question 143. What does the medical abbreviation ADL mean? Option A, additional daily lessons. Option B, activities of daily living. Option C, advanced dietary limits. Option D, average daily loss.
The correct answer is option B, activities of daily living. Activities of daily living include basic self-care tasks like eating, bathing, and dressing.
Question 144. Which equipment should you have available when caring for a client's beard? Option A, towel, gloves, razor, and shaving cream. Option B, a bowl of hot soup. Option C, a pair of scissors and a hair dryer. Option D, nail clippers and lotion.
The correct answer is option A, towel, gloves, razor, and shaving cream. Standard shaving supplies and gloves are required for safe and hygienic beard care.
Question 145. When assisting with dressing a client with left-sided weakness, what part of a sweater is put on first? Option A, the right sleeve. Option B, the left sleeve. Option C, both sleeves at once. Option D, the collar.
The correct answer is option B, the left sleeve. Always dress the weak side first to make the process easier for the resident.
Question 146. A safety device used to assist a dependent client from a bed to a chair is called what? Option A, a life jacket. Option B, a transfer or gait belt. Option C, a pair of handcuffs. Option D, a heavy rope.
The correct answer is option B, a transfer or gait belt. The belt gives the assistant a secure grip to help the resident during the transfer.
Question 147. The nursing assistant is caring for a patient who is on a bowel regimen and has not had a bowel movement in 4 days. What is the assistant's next step? Option A, report this to the nurse in charge. Option B, give the patient orange juice with Miralax. Option C, encourage the patient to drink more water. Option D, nothing, this is normal.
The correct answer is option A, report this to the nurse in charge. A change in bowel habits or a lack of bowel movements for several days is a significant finding that must be reported to the licensed nurse.
Question 148. You are assisting a diabetic patient with eating and he only finished 25% of his meal. What should you do? Option A, report this to the nurse in charge. Option B, nothing, the patient may not be hungry. Option C, tell the patient they must eat more. Option D, chart the patient ate 25% of the meal.
The correct answer is option A, report this to the nurse in charge. Diabetic patients require consistent carbohydrate intake to balance insulin. Low food intake must be reported.
Question 149. The CNA is assisting a client on swallowing precautions. Which should be included in the plan of care? Option A, client should not be left unattended when eating. Option B, give the client the regular dietary menu. Option C, instruct the client to tip their head back to swallow. Option D, no additional precautions are needed for soft foods.
The correct answer is option A, client should not be left unattended when eating. Patients with swallowing difficulties are at high risk for aspiration and should never be left alone while eating.
Question 150. The nurse aide is caring for a patient with stress incontinence. What is necessary for this patient? Option A, a Foley catheter to keep the skin dry. Option B, frequent toileting breaks throughout the day. Option C, less fluids to keep them from urinating. Option D, diuretics to help keep the bladder empty.
The correct answer is option B, frequent toileting breaks throughout the day. Stress incontinence can be managed by scheduled toileting to keep the bladder empty and reduce accidents.
Question 151. The nurse aide observes a resident sweating, feeling dizzy and appearing anxious. What is the first step? Option A, call for the nurse immediately and stay with the resident. Option B, offer the resident a glass of water. Option C, help the resident brush their teeth. Option D, leave the room to find a glucose monitor.
The correct answer is option A, call for the nurse immediately and stay with the resident. Sweating and dizziness are signs of a serious medical issue. The aide must stay with the resident and summon help.
Question 152. Which activity can be completed by a nurse aide? Option A, administering intravenous medication. Option B, dressing a wound. Option C, assisting with bathing. Option D, assess change in mental status.
The correct answer is option C, assisting with bathing. Nurse aides are trained to assist with activities of daily living such as bathing. Meds and assessments are outside their scope.
Question 153. While brushing a client's hair, the CNA observes several sores on the scalp. What is the CNA's best action? Option A, report the sores to the nurse. Option B, shampoo the client's hair and scalp. Option C, apply antibiotic ointment to the sores. Option D, ask the family to provide lotion.
The correct answer is option A, report the sores to the nurse. Report the sores to the nurse. The CNA should report all observations and changes to the nurse. The nurse can then assess the client and determine proper action. The CNA scope of practice includes providing basic care and assisting with the ADLS under the supervision of a licensed nurse.
Question 154. When the CNA forgets to lock the wheels on a wheelchair and the client falls, what should the CNA be charged with? Option A, negligence. Option B, battery. Option C, malpractice. Option D, assault.
The correct answer is option A, negligence. Negligence. The CNA could be charged with negligence because they did not use medical equipment properly, or as they were trained to do. Malpractice is when actions or failure to act do not follow the accepted standard of care, resulting harm or injury to a patient. Assault is when someone creates a reasonable fear of imminent harm. Batter is actual and unlawful physical contact or harm on another person.
Question 155. When providing client care, standard precautions are required for all of the following body fluids and secretions except Option A, urine. Option B, sweat. Option C, vomit. Option D, blood.
The correct answer is option B, sweat. Sweat. Standard precautions are the basic level of infection control that should be used in the care of all patients all of the time. They apply to blood, all body fluids, secretions and excretions, except sweat, whether or not they contain visible blood, non-intact skin, and mucous membranes. Standard precautions include hand hygiene, respiratory hygiene, PPE, cleaning/disinfection, and waste disposal.
Question 156. Before transferring a client from their bed to a wheelchair, what is the first thing the CNA should do? Option A, lock the wheels of the bed and the wheelchair. Option B, let the client dangle their legs before standing. Option C, raise the head of the client's bed. Option D, assist the client to a full sitting position.
The correct answer is option A, lock the wheels of the bed and the wheelchair. Lock the wheels of the bed and the wheelchair. This prevents falls during transfer. Once the wheels are locked, can help put on footwear, assist the client to the edge of the bed to dangle their legs and carefully stand and pivot toward the wheelchair. Ensure client's legs are in contact with the seat of the chair before lowering them into position.
Question 157. After helping a client to use the toilet, the CNA prepares to provide perineal care before returning the client to their bed. If the CNA discovers there are no washcloths or wipes in the bathroom, what is the best action? Option A, tell the client to remain still and quickly leave to get supplies. Option B, return the client to their bed and then perform perineal care. Option C, use the bathroom call light to ask a team member to bring supplies. Option D, wait until the next toileting to provide complete perineal care.
The correct answer is option C. Use the bathroom call light to ask a team member to bring supplies. Use the bathroom call light to ask a team member to bring supplies. The CNA should remain with the client, never leave a client unattended when they need assistance to use the bathroom. It is inappropriate to postpone perineal care.
Question 158. What is the most effective way to prevent the spread of infection? Option A, remaining home when sick. Option B, getting recommended vaccinations. Option C, proper hand hygiene. Option D, appropriate use of gloves.
The correct answer is option C, proper hand hygiene. Proper hand hygiene. Hand washing is the most effective way to prevent the spread of bacteria and viruses. Using soap and water is the preferred method. Alcohol-based hand sanitizer is also effective.
Question 159. The CNA is feeding a client with Alzheimer's disease. During the meal, when should fluids be offered? Option A, throughout the meal. Option B, before starting to feed. Option C, only at the end of the meal. Option D, after each bite of food.
The correct answer is option A, throughout the meal. Throughout the meal. Fluids should be offered at regular intervals during the entire meal to help the client's mouth stay moist. It makes it easier for the client to chew and swallow. Clients who may require feeding include those with cognitive impairments.
Question 160. During a transfer from their bed to a wheelchair, a client suddenly complains of pain. What is the CNA's best action? Option A, stop the transfer and return the client to bed. Option B, try a different method to complete the transfer. Option C, finish the transfer and then tell the nurse. Option D, call out for emergency assistance.
The correct answer is option A, stop the transfer and return the client to bed. Stop the transfer and return the client to bed. If a client suddenly complains of pain during a routine transfer, the CNA should immediately stop and return them to bed. The nurse can then assess the client and another method may be used after the client has been assessed. The CNA should not ignore the complaint and continue the transfer.
Question 161. The nurse aide notices that the client's radio cord is draped across a chair to reach the nearest outlet. The first thing the nurse aide should do is: Option A, tell the client the radio is a safety hazard and take it away. Option B, take the radio to the activities room and tell the client to listen there. Option C, see if any changes can be made so that the radio can be plugged in safely. Option D, unplug the radio and ask the client not to use it.
The correct answer is option C. See if any changes can be made so that the radio can be plugged in safely. See if any changes can be made so that the radio can be plugged in safely. All facilities must comply with the electrical safety standards of governmental and accrediting agencies. Client devices, including radios or televisions, must be approved according to facilities' policies. The nurse aide can help the client find a place for the radio where the cord to be safely plugged in, so the client can continue to enjoy listening.
Question 162. While eating dinner, a client starts to choke and turn blue. The nurse aide should: Option A, call for assistance and perform the Heimlich maneuver. Option B, give the client a drink of water. Option C, slap the client on the back until the food dislodges. Option D, immediately remove the client's food tray and go find the nurse in charge.
The correct answer is option A. Call for assistance and perform the Heimlich maneuver. Call for assistance and perform the Heimlich maneuver. Calling for assistance as you prepare to do abdominal thrusts will alert others to the emergency. You can try a quick back slap, but if the food is not immediately dislodged, quickly start abdominal thrusts.
Question 163. The nurse aide is walking with a client confined to a wheelchair when the facility fire alarm system is activated. The client becomes excited from the noise. The nurse aide should: Option A, push the wheelchair out of the hallway and carry the client out of the facility. Option B, lock the client's wheelchair and check the surrounding area for smoke. Option C, comfort the client while moving the person to a safe place. Option D, leave the client to search for help.
The correct answer is option C. Comfort the client while moving the person to a safe place. Comfort the client while moving the person to a safe place. The nurse aide should be familiar with all fire safety policies and protocols. When a fire alarm sounds, all staff must respond to keep clients safe. Remember RACE.
Question 164. The nurse aide is going to help the client walk from the bed to a chair. What should the nurse aide put on the client's feet? Option A, cloth-soled slippers. Option B, rubber-soled slippers or shoes. Option C, socks or stockings only. Option D, nothing.
The correct answer is option B. Rubber-soled slippers or shoes. Rubber-soled slippers or shoes. When helping a client ambulate, you must prevent the client from falling. Proper footwear should always be worn for any type of walking, even short distances. Rubber-soled slippers or shoes provide traction to prevent falls.
Question 165. A professional and safe working appearance would include which of the following? Option A, sandals, t-shirt, and a name tag. Option B, clean, wrinkle-free uniform, short fingernails, and off-the-shoulder hair. Option C, carefully manicured acrylic nails. Option D, jewelry that reflects your fun personality.
The correct answer is option B. Clean, wrinkle-free uniform, short fingernails, and off-the-shoulder hair. Clean, wrinkle-free uniform, short fingernails, and off-the-shoulder hair.
Question 166. To help ensure adequate circulation to prevent patient skin breakdown, you should: Option A, perform active or passive range of motion exercises. Option B, give back massages. Option C, change the patient's position frequently. Option D, do all of the above.
The correct answer is option D. Do all of the above. All of the above. One of the primary responsibilities of a nurse aide is to monitor the client's skin for any signs of breakdown. During baths, dressing or position changes, inspect the skin. Reposition every 2 hours, protecting areas that rub together as well as the bony prominences. Massages of the back and buttocks can promote circulation. ROM are also helpful and report any changes to the nurse.
Question 167. A patient who was given insulin in the morning is pale and sweaty and appears confused 2 hours later. It would be helpful to find out whether the patient: Option A, had visitors that day. Option B, ate too much sugar. Option C, had breakfast. Option D, has diabetes.
The correct answer is option C. Had breakfast. Had breakfast. Diabetic clients have a strict schedule regarding insulin injections and eating. Eating causes blood sugar to rise, and the insulin helps move it into the cells. Without food, the blood sugar drops quickly, causing a serious situation. Immediate treatment is necessary. Quickly check the blood sugar level and report it to the nurse. The client will need to eat 15 grams of glucose or a simple carb such as a 1/2 cup of orange juice or a tablespoon of sugar. The nurse aide should be aware of which clients are diabetic so that meals are served shortly after the client receive insulin.
Question 168. The nurse aide notices on the flow sheet that a resident has not had a bowel movement for 5 days. The nurse aide should: Option A, report this to the charge nurse. Option B, wait to see if she uses the bathroom tomorrow. Option C, ask the resident's roommate if she saw the resident use the bathroom. Option D, ask the other nurse aides if the resident had a bowel movement that wasn't recorded.
The correct answer is option A. Report this to the charge nurse. Report this to the charge nurse. Although each person has a unique pattern of bowel movements, the normal number is 3 to 14 times a week. If the client has had a sudden change in bowel habits or is experiencing bloating, pain or nausea, the cause should be investigated. Adding fiber and fluids to the diet can help prevent constipation.
Question 169. A diabetic resident asks the nurse aide to cut her toenails. The nurse aide should: Option A, do it because it is part of the job. Option B, tell the resident okay, but they will have to soak their feet first. Option C, tell the resident that the nurse aide cannot do it but will report it to the charge nurse. Option D, ask another nurse aide to help.
The correct answer is option C. Tell the resident that the nurse aide cannot do it but will report it to the charge nurse. Tell the resident that the CNA cannot do it but will report it to the nurse. Diabetics often have neuropathy and may be unable to tell if their feet are injured. Even trimming toenails can cause an injury. Diabetics need expert care from a podiatrist or a qualified foot care professional. You can be held liable if the client develops an infection after you cut her toenails.
Question 170. A Foley catheter is used, option A, as a rectal tube, option B, to suction stomach contents, option C, to drain urine from the bladder, option D, for gastric feeding.
The correct answer is option C, to drain urine from the bladder. To drain urine from the bladder. A Foley catheter is a sterile tube that is placed into the bladder to drain urine. It is held in place by a balloon that is inflated after being inserted. You should check that the tubing is open so that the urine can flow from the bladder. After each position change or whenever the client returns to the bed or chair after being up, ensure that the tubing is not kinked or closed and the bag is lower than the bladder to prevent backflow.
Question 171. A bed sore or decubitus ulcer is caused by, option A, burns, option B, fatigue, option C, inadequate turning, option D, abrasions.
The correct answer is option C, inadequate turning. Inadequate turning. One of the primary responsibilities of the nurse aide is to monitor the client's skin for any signs of breakdown that could lead to bed sores. During baths, dressing, or position changes, inspect the skin for redness, pallor, warmth, or bruising. Reposition at least every 2 hours, protecting areas that rub together. Massages to the back and buttocks can promote circulation. ROM exercises are also helpful. Always report any sign of skin breakdown to the nurse.